This is a general disclaimer. Redlands Community College attempts to have the most accurate and up-to-date information listed in its content and delivery. However, your education is your responsibility. Redlands Community College or Roy Smith makes no guarantee in the accuracy of this information in this video and accepts no liability for the informational video. The information expressed is strictly the opinion of the author and the presenter, which is listed in the reference near the end of the video. This information is designed to supplement your own education or initial education and should not be used to replace any current academic program you're enrolled in. View the information and content at your own risk. Thank you. This is going to be Chapter 14, Disorders of Homeostasis. Key concepts. Upon completion of this chapter, you'll understand how the body regulates its internal environment to maintain balance or homeostasis, that the endocrine system secretes hormones that interact with all body systems, that hormones can directly cause an action or can stimulate another organ to release a chemical that will cause an action, how the body's inability to maintain homeostasis may be the cause of it or the result of critical illness or injury. So we're going to look at endocrine glands, their interaction with the bodies. Most of these are cascading hormones, so it gets very complex very quickly. Chief concern, homeostasis. Several complex regulating mechanisms, and these are things that they control all the time that we have no mental thought process over, would be metabolism, temperature, blood chemistry, and glucose levels. Major disorders affecting homeostasis are things like pituitary, adrenal, thyroid, fluid, and electrolyte disorders. This is figure 14.1. The pituitary, adrenal, and thyroid glands are a part of the endocrine system, and they help regulate the body systems. Pituitary disorders. The pituitary gland is located in the brain. Hormones produced regulate growth, reproduction, and development. Things like, and this is all from the pituitary, thyroid-stimulating hormone controls the thyroid gland. Adrenocorticotropic hormone controls the adrenaline gland. Antidiuretic hormone signals the kidneys to absorb water. Disorders, and from all of these we can have problems that are systemic. Hypopituitarism, often caused by decreased blood flow to the pituitary from a tumor compressing the pituitary. It can also cause subarachnoid hemorrhage, traumatic brain injury, inflammation of the pituitary gland, or in women, necrosis of the pituitary after childbirth. Hypoadrenalism, or low adrenaline levels, decrease adrenaline gland function. Diabetes insipidus, deficiencies in antidiuretic hormone and vasopressin. Now, most people think whenever they hear the word diabetes insipidus, it has something to do with blood sugar, and it does not. It's another hormone, antidiuretic hormone and vasopressin to be more specific. Adrenal disorders. The adrenaline glands sit on top of the kidneys. The medulla of the adrenal glands manufactures and secretes epinephrine and norepinephrine into the bloodstream. Response to activation by the sympathetic nervous system. This is their primary neurotransmitter. The cortex secretes 3 different types of steroids, perform various automated functions. The glucocorticoids control glucose production, protein, fat, metabolism, and maintain the salt balance. Now, the maintaining of the salt balance is mineral corticoid, things like aldosterone. So, glucocorticoids are responsible for the action that assists the body in responding to stresses. Aldosterone, primary mineralocorticoid, responsible for increasing sodium and water reabsorption in the kidneys while causing a release of potassium in the urine. Disorders, excess or decrease in adrenal hormones. An example of this is going to be Cushing syndrome. Cushing syndrome, an excess, and there's an excess or hyperadrenalism. Excess of adrenal hormones causes, and this would be too much sympathetic hormone, would cause hypertension, elevated blood glucose, insulin resistance, and hypokalemia. Thyroid disorders. Thyroid gland is located in the anterior of the larynx and controls the rate of energy production and function. Disorders on this are something as simple as a goiter, which is enlargement of the thyroid gland, may be caused from inflammation, cancer, or overproduction of hormone. Hyperthyroidism can often occur for several reasons, including problems with the pituitary gland, thyroid stimulating hormone being an example of that, inflammation of the thyroid gland, that may be caused by radiation, infection, trauma, or autoimmune disease or drug use. Graves' disease, or hypothyroidism, is induced by an autoimmune disease, not enough thyroid. Exophthalmosis, which is bilateral protrusion of the eyes, we see a lot of time, due to deposits of connective tissue behind the eyes. Thyroid storm occurs due to an elevation in thyroid hormones that is often precipitated by specific events such as surgery or an infection. Hypothyroidism, decreased amount of circulating thyroid hormone, very, very simple on that. And myxedema, severe and rare form of hypothyroidism. Myxedema coma alters their LOC, low thyroid, no cellular gas pedal, so to speak. Essentially, it controls the rate of energy production and function in the body. Electrolyte disorders. 2/3 of the body consists of water. Several electrolytes or salts are dissolved both in the intracellular and the extracellular environment. Proper body function, the body tries to maintain electrolyte concentrations, things like sodium, potassium, magnesium, and calcium. Depends heavily on the hormones produced by different endocrine glands and the function of the kidneys and water intake by the patient. So all of this goes into play whenever we're trying to look at is the patient maintaining their electrolyte balance as well. Sodium normally has a higher extracellular concentration. The extracellular fluid normal concentration is generally between 135 and 150. Normal concentration in the intracellular environment, this would be inside the cell, is going to be 10. So this guy here really likes to stay outside the cell, and that's important, especially whenever we're looking at sodium-potassium pump usage. Used to remove or retain water in the body. Aldosterone in the kidneys is a mineral corticosteroid. It increases absorption of sodium and increases water content. This in turn increases blood pressure. So water follows sodium. If aldosterone is controlling sodium or retaining more of it, then thereby that's a long-term process of increasing blood pressure. Disorders that we find are going to be things like hyponatremia, less than normal blood concentrations, which would be less than 135, and then hypernatremia, which would be concentrations higher than 150. Both of these can cause both altered mental status and fluid electrolyte problems. Potassium, it works in combination with sodium, changes electrical potentials of nerve cells, and it is also very important in the cardiac conduction system. The normal extracellular concentration of potassium is going to be 3.5 to 5. And the normal intracellular concentration, now this guy likes to reside inside the cell, is 100 to 150. Disorders of this, hypokalemia, low potassium levels, which if you get potassium that's too low, like a 1 or a 2, very simply the heart will not function appropriately. And then hyperkalemia, too much of it. So if we get a 9 or a 10 in the same breath here, higher than normal, and it can cause cardiac dysrhythmias. Magnesium. Significant roles of magnesium are central and peripheral nervous system tissue, energy, proteins, and DNA production, binding hormones to cell receptors, normal extracellular concentration of mag is going to be 1.5 to 2, and that's milliequivalents per liter. Normal intracellular concentration, and this guy resides mostly in the cell, is going to be 40. Disorders, hypomagnesemia, low magnesium levels in the blood. Number one cardiac dysrhythmia that we can get from this, it would be torsades de pointes. The number one cause of torsades when seen in patients statistically is a low magnesium level. And then hypermagnesemia, elevated mag levels in the blood. Calcium, essential for muscle and cardiac contraction and intracellular function. Bones and teeth are made up of calcium and also store calcium. Disorders is hypocalcemia, abnormally low levels of calcium in the blood, and then hypercalcemia, elevated levels of calcium in the blood. Calcium is essential for cardiac muscle contraction and muscle contraction in general. History. Altered mental status or consciousness. A thorough history needs to be obtained. Key to determine the source of the symptoms. Family, friends, or any witnesses can give important pieces when the patient is unable to speak. Determine specific symptoms. Sometimes these symptoms may actually overlap. Past medical history may be helpful. Key elements in history are going to be ample. Allergies, medications, last meal, events leading up to the assistance for requests, or events leading up to the actual them calling 911, and a history of any type of substance abuse. On examination, the patient with an altered mental status in the primary assessment resolve any life-threatening issues. Ensure that we have a patent airway, provide adequate oxygenation and ventilation, and provide adequate circulatory status. You may have to give fluid boluses, you may have to assist their ventilations, you may have to intubate them. Secondary examination, general appearance, neurological examination. Cardiovascular examination, do a 12 lead if you have any type of altered mental status. Psychiatric examination, and obtain a rapid blood glucose. It may be as simple as a low blood sugar. Assessment continue. Many conditions cause altered mental status. Thyroid storm, or a combination of any of these, causes a decline in mental status, weight loss, a hyperdynamic state, or enlarged thyroid may give us exophthalmosis, which is bulging of the eyes. In treatment, we should generally provide supportive care, focus on maintaining their airway, breathing, and circulation. Any kind of airway adjuncts or intubation, breathing with supplemental oxygen, and circulation if they have ample blood pressure, or treat them accordingly so that they don't become hypotensive. An evaluation. Paramedic during transport should continuously monitor the patient, their airway patency, the adequacy of their ventilations, and the effectiveness of their circulatory system. In disposition, most of the conditions discussed can be handled in a local hospital, electrolyte disorders and endocrine conditions, or any type of altered mental status. In conclusion, the body hosts an amazingly complex collection of interrelated systems that maintain homeostasis. These mechanisms can easily become disrupted in critically ill patients. Disorders of the homeostatic mechanism can also have profound effects on the patient and produce seemingly unrelated signs and symptoms. The paramedic may be the first healthcare provider to encounter the patient who has a disorder of their homeostatic mechanisms. References for this were taken from Professional Paramedic Volume 2, Medical Emergencies of Del Mar Learning. And if you have any questions concerning this chapter, feel free to give me a call. My name is Roy Smith, roy.smith@redlandcc.edu, or 405-219-7613. Thank you.